my time is very powerful. My gender pronouncedly here. Before we start, I would like to do another survey. If this is your first time being in the museum, please raise your hand and let me know. Welcome, welcome. And I certainly hope that we can see you here again soon. Together, I have P5, who the director of programs. We have been both working hard on creating the queer series at the Museum of Chinese America by acknowledging the fact that we haven't had enough representation at the museum. Though if you have a chance to go through the exhibition, you might be able to identify some historical figures, such as Dr. Jessie Chan, who is the very first cross-dresser and also a female surgeon, allegedly a bisexual. And we also have the gay surgeon, the community surgeon. Supposedly, we have a fourth speaker today, Don Cao, who is actually a queer activist. He's been active since the 1970s. He's the one that actually organized the Asian Caucus during the Third World Conference, and then later organized the Gay and Lesbian March in Washington, D.C. in 1979. That is the very first march ever passed through Chinatown. So that was quite a historic moment. If you can later on go see that cover, you will see there's a banner that says, "We are Asian, gay, and proud." That is really our history. And based on that, both Ivan and I are committed to doing more to make sure that museum is an inclusive space, but also in the space for resources and whatnot. So that's the reason why we have the mental health symposium today, focusing on the AAPI LGBTQ mental identity, not mental issues or mental awareness. So the way that we're gonna do it today is we're gonna have our experts to introduce themselves a little bit, and then we actually prepare a series of questions. We're gonna go through those. After that, we'll open the floor for you. If you have any questions to ask, please feel free. And same thing as our friend online. If you have any questions, please just leave it on the comment section, right? Sure. And then we'll go through the questions as much as possible. Okay. So without further ado, let's please welcome. Sorry.
Turn that. Just okay, there we go. Okay. Hi everyone, I'm Henry. He, they pronouns. So yeah, I'm a queer Asian therapist, coach, consultant. Let's see, what can I tell you? My career in therapy is actually somewhat new. I'm coming from a past career in technology. Been there for about 7 years, building very interesting products at a big tech company. But just kind of realized that I wanted to reconnect with my community and work with a lot of issues around, issues that queer people of color face. So yeah, that's kind of what I've been really focused on. I'm a therapist at the Q Collective, so we're primarily private practice. We do a lot of work with trans and non-binary, queer adolescents. I also work with couples. I facilitate group therapy. Yeah, that's about it.
And next we have Jihan.
Hi, I'm Jihan Ryu. I'm a psychiatrist. I am currently a full-time psychiatrist at Connect program that is represented way in the back, so please feel free to say hi. So our organization's mission is primarily providing equitable care to especially underserved populations. So our organization has been having long history, about hundreds years plus now, of dedicating all kinds of social services, including mental health services, to communities, mostly communities, but communities of all colors too. Within it, I am part of this program that is specifically outreach focused, meaning that we can go out to their home environments, or we can meet them at the parks or cafes, just to meet them where they are, just to make the traditional environment of treatment to be more flexible and creative. Because a lot of time we found that those are the barriers for people to come to traditional settings, treatment. So that's what I'm doing. So I do work with a lot of different mental health professionals with different backgrounds, including therapists or social workers, doctors, nurses. So I'm pretty broadly trained in the field of mental health and very focused on public health. And I happen to be also queer and I have specific like interests as well as like wisdom to share as a person and not just as a doctor.
Thank you. And last but not least, we have Shirley.
Okay, so I'm come from a little different. So I'm the community outreach coordinator for the Gracie Square Hospital, which is affiliated with MYP Hospital. So our hospital is the inpatient psychiatry, provide inpatient psychiatry service. And we have an intern unit in New York State. So we have in our unit, we have a nurse and also the nurse aide, psychiatrist speak Asian language so we can provide the service to the patient and family member. And recently we also provide the free mental health seminar workshop in the community. So if you know anyone, I speak Mandarin, Cantonese, and Taiwanese. If you know anyone want the service, feel free to contact me. And I'm also new counselor with the limit permit right now, so I'm interested in working with the AAPI also the LGBT plus. But if you have any question, feel free to ask me. I also have a table there with the stress ball. If you need any when you're angry, stress, you can have the stress ball. Go into somebody, it's fine, but it's illegal, but you're not gonna hurt somebody, okay?
So let's just get into it. The very first question. So we know that there are so many different titles out there when it comes to mental health experts. You know, we know from they say we have therapists, and even among therapists, world, there's art therapy, there's dance therapy, there's all kinds of therapy. We also have psychiatrists, psychologists, we have social worker, we have psychoanalyst. What are the differences around all these practices in your own understanding, and how do we approach?
I can go ahead and you guys can jump. I think difference. So I want to like obviously start with commonality because we all treat the same person basically. Maybe the settings in which we see or encounter those patients might be different, but we basically are trying to diagnose, if necessary, treat, prevent mental illness. So that's what we do. I think differences really come from their training, like background and then materials or the types of mentors or supervisors they have had in their life. So obviously, I mean, I'll have you and we can speak about therapy a lot more, but like, um, so you're asking about differences, I guess. So yeah, like some people go to like college school, some people go to social school. I think the materials are a little different in the way they approach like how to how to talk about or approach the topic. So, for example, social work can talk a little bit about systemic issues and court services and like actual delivery of what already existing, like why is it not getting to our community so that they can think a lot about those system or delivery issues. Um, Doctors are trained more from a medical background, so they see mental illness not just as something only psychological, but they can think of it more broadly, like is there something going on in the brain? Is there a tumor in the brain? Or are you not just depressed, but are you actually about to be demented if you're like older? And so you need to like approach this more, I guess, scientifically, and hence the background of medicine can be helpful in certain issues. Yeah, I mean, I guess I do, you know, to the question, I always think about like, really the question for, you know, the audience is like, who do you choose is the right probably the question. And I think that just requires a little bit more of like introspection of what you're looking for, what type of approach you're compatible with, and then find from there.
And here perhaps you want to talk about therapy?
Yeah, so I think like everyone sort of knows this household name of therapists, right? So even within therapy, like there's social work. A lot of social work folks do like administer therapy. Like you might see titles like LMHC or LMSW. So like both licenses are capable of providing psychotherapy. Within the world of psychotherapy, there's a lot of different domains, right? You mentioned Dennis, like art therapy, music therapy, and so I think that speaks to a lot of different modalities by which therapy can happen. obviously maybe the most common one is talk therapy, right? The one where we're like sitting across from a therapist and having a conversation. But it can be also these other forms. And then there's one that Dennis mentioned called psychoanalyst, which is a type of psychotherapy, which is less about sort of fixing or like treating like goals and problems, but more about uncovering the unconscious. So understanding sort of like like how did your personality come to be? And so psychoanalysts are focused on sort of understanding the unconscious and then slowly over time changing it. It's a very sort of intensive, like you see them 3 or 4 times a week and you'll be with them for like many years. So it's kind of more of a niche thing. I think typically when it comes to therapy, yeah, like therapists are trained in a whole bunch of different modalities, and that's probably the most common one.
Sure, I mean, perhaps for you, can you talk a little bit about, how do we identify what actually works best for us?
Actually, we always talk about when we give our presentation, we always talk about everything's combination. The medicine, also therapy is combined. Like in hospital, that is a combination. So for example, they will see the psychiatric medication every day, but we don't have the therapist in the hospital because the time of it's a short-term hospitalization. So, when you go to therapist, it takes time to build that relationship with the therapist until you're able to share your feeling. So we have the theoretical activity. So we have different music group and then art group. Some people, some patients, they're not able to share the feeling in words. They cannot tell you upset, but they would join like what happened. They would use dark color, black color, and then you ask them how what does mean, so they're able to share a little bit. I don't feel happy. And that, and then also the social worker, we don't provide the therapist from the social worker. They mostly help patient back to the community. For example, schedule the psychiatry and schedule the therapist. So after they discharge from the hospital, we have to make sure they're able to have those care and prevent them to returning to the hospital. And that is always not only one. Some people, it's also up to if you have a mild depression or mental illness, you can go to talk therapist. But if you have a severe mental illness, you have to use medication to calm down yourself until you're able to realize what you're experiencing and how you look. So yeah, there's no one-on-one, always combine and different therapists. It's up to you. Some people are like music, I want to go to music therapist. Some people want art. Yeah, like that too. And talk therapist.
And just quickly following up with this question, do we only look for help when we feel we're sad, or can we just talk to a therapist if we feel fine?
I'm a little biased. I think, yeah, I think therapists, therapy is not just for when you're experiencing a really acute problem. I think therapy, I think like to take a step back, right? Like we're kind of, living in a really, really bizarre world right now, right? Like where, a lot of folks who, especially as we're gonna touch on, who have minority identities, experience a lot of oppression, right? And so there's something to be said about systems in which we live, right? And so like for us to go through it fine, it's great, but like I think a lot of us, are really like struggling, whether or not we show it or how we show it. I think it is really hard to endure during every day. And so I think talking to a therapist to help like work through some of those experiences can be really helpful, even if it's not like, let's say like acute like suicidal ideation, like you're feeling really depressed, right? I think there are lots of chances to engage in therapy.
Also, I want like in my culture, Asian culture, I'm so hard. I'm afraid to share my shame and worry to other people. The first is a burden. I don't want to give a burden to others, and I don't want to let know what's going on. It consider no face. So to go to the therapist, I feel like more safe. And the HIPAA, they cannot share anything by talking in the section, so keep everything here. And then the therapist can catch if you have anything happen, they can target that working with you with the skill and everything. So I think it's early prevention as well, so helping for future and so.
What about psychiatrists? Can people just go talk to a psychiatrist without realizing there is an issue?
I think it's up to what they're looking for again. If you want like broad like psychiatric consultation, very holistic point of view, like and you feel that medicine is a framework choose to do that with, then yes, you can. But I think generally I would agree more with what our colleague said about it's about like preventing that should also like come into your mind, not when you're already sick, when you other people said you're sick, because that sometimes is a little too late from like spectrum of disease stuff. You can conceptualize it like that. Like sometimes when it's showing, it's sometimes late. Um, so I'm very passionate about like preventing people from getting sick to begin with. So I would welcome, obviously, but choose judiciously. Like know what you want, then make. Then you don't have to know everything. You can just ask.
So my next question is, this is our big topic of the day. What does LGBTQ stand for? And how can one figure out where they identify with?
Who knows the alphabets?
Yeah, I can maybe start. So yeah, LGBTQ, right? Like we throw around this term as like a broad spectrum. So lesbian, gay, bisexual, trans, and queer. And the plus is, everything in and about and under the umbrella, right? And so, we tend to think of it as sort of very diverse in terms of gender and sexual orientations. And so in terms of like where people sort of I think everyone has kind of their own process, right, of coming to terms with like their own gender identity and sexual orientation. And it's just, it's a long journey, right? I think uh, typically folks might have ask questions, about their sexuality when they're young, but it may also be that some folks don't come out much later, right? And a lot of this has to do with the environment, right? Is it safe to come out? Like who is in your environment context? For you to be present and sort of feel authentic. I think a lot of it comes back down to like authenticity, right? Like feeling like you can be who you are, in however way you express yourself and whoever you like, whoever you love. And I think one thing I'll say is, it's evolving, right? And how it looks may be different a couple years from now, but wherever you are, it is okay to be in a state of not knowing or uncertainty, which day.
Yeah, no, I want to add to that you don't also have to know or feel like you have to be in one of those topics, right? Because it's at the end of the day, we'll have to ask the question of like, how is the label meaningful to me? Is this because it's helping me create a community that I currently don't have, or is that because it now like helps you make sense of yourself better? So if these are like all positive reasons and values, I would say go ahead and find it if you would like. I think it's really important to validate to Henry's point to be okay if you're in between or not knowing, right? Because LGBTQIAA plus, like there's a bunch of other in betweeners too that need to be represented and seen. So I think really it's about being authentic and finding how is this label for the community useful or personally meaningful to you at least, and then start that conversation within yourself first, or or with others.
I guess I'm gonna move on to the next question. When we talk about coming out and you touch on labeling yourself. So within our community, API, though that idea of API is very broad and very ambiguous, that just for the sake of it, let's just use that. Do you think within our community coming out is necessary? And how can someone decide when to come out? Or maybe not?
Like general, to you have to validate yourself, and sometimes you have to explore with yourself. What is that coming out means to you? What is the goal for it? So you cannot just be like everyone doing that and out. So you have to validate your feeling and your thought and validate yourself. And then, yeah, so if you feel comfortable, you want to share what are you to others, you can do it. But if you feel like I don't feel comfortable, so just be yourself, right? Validate what are you and what are you looking for? Validate your feeling.
I think coming out is super personal experience, and therefore you there's no right answer, including whether or not to even come out. I would say things to consider though when you are at the verge of coming out or thinking about it is first really be clear on your safety and boundaries as well. There's a lot of times, and could be feeding cultural issues too, but sometimes it's not safe to come out, and then there's a lot of practical logistic reasons why it could hurt you, even though you are being authentic, and that positive thing that can come at a cost. That calculation is valid, and that is part of what we do with therapy too, is just to help clients and patients explore the pros and cons of their decision. So I would say always, like consider safety, and then it's okay if you can or don't come out right now. Again, like you said, time can change, your perspective may change. Um, and the other side of that is to find also supports. Not always look out for dangers, but also like see who actually accepts you as who you are right now, and then find out right around first.
Yeah, I think I have much to add. I think the thing I'll stress is that like it truly is a negotiation with all the different variables, right? Like it's about safety, it's about like pros and cons on the other side. And also like to reemphasize like it's evolving. I think everyone will continually come for a long time, right? Whether it's to, your friends now, family, or people in the future. It's just, one of the decisions that you have to think about. And yeah, and I think it's just thinking about it from safety and just like balancing all things.
So to follow this question, sometimes we don't necessarily feel safe when we realize our family members hold a very strong opinion about LGBTQ identity. There might be some homophobic slurs being used or some maybe bad comments, and now that our society has moved towards more conservative viewpoints. So how does one who identifies queer or one of the LGBTQ identity navigates that family relationship?
I think it's really, even though it's not that topic family, also we talk about the generational gap. So even though just different topic, like me, it's so hard to communicate with my parents, even though we just talk about everything. So I'm thinking if you could not find the validation from the family member, if they don't understand, sometimes you can be over here and give them more time, more space, let them understand and see how's everything going on. So I would recommend and suggest looking for some community support and friend support and also online or in-person support to get the validation. I know most of the time family is very important to us, is our roots, is our everything. But try to reduce the conflict with the family members. So just tell them what are you feeling, what's your thought, and then let them understand. So we cannot please everybody, make them happy, make them agree with me. But you cannot control their mind. But what you can do is comfort yourself and make yourself comfortable, focus on yourself before you let other people.
And maybe I'll add, I think in a lot of Asian cultures, there's this like difference to elders, right? Respect for elders, and the desire to like maintain harmony in the family, right? I hear like a lot of my clients talk about, not like their coming out stories are reflecting in some way on the family. That family sort of has a reputation, right? And yeah, I think to what Shinling said, I think it's important to understand like how do these relationships will fit in for you, right? And yeah, I think maybe more like Western form of therapy, you might say like, oh, you just don't talk to your family, right? You might just hear like, oh, well, you just gotta block them, right? Just don't talk to them. And in some cases that might be what you want to do because of safety reasons. But I think for Asian folks and therapy, right? Like culture is such a big part of who we are as people. And I think part of it is just acknowledging, like, yeah, that it can be really challenging, right? To sort of have these values of respecting others. But to Shulman's point, I think finding sort of maybe like a chosen family who like you get to pick and who really support you unconditionally, can be helpful.
Yeah, I sort of want to also follow up on this. I'm wondering in your experiences, have you worked with clients that might not just be an individual, but actually a family and help them navigate how to embrace the fact that, one of the children is actually queer and help them also navigate the cultural values versus their sexual orientation and gender identity? And if not, do you think that would be a good idea for them as a family to look for help?
Yes, of course. So, like I work with the patient, so no matter what patient they want to live their foundation, so I always, because I also work in the army with the all the family to family support. So those are the family members. They really want to understand what happened, what's going on with the family member. So I would suggest if you can look for some family therapist, family group, and then invite family to listen to understand. So that would be a good idea too. Or also, if you are already seeing the therapist, individual therapist, so there's different type of therapists you can provide, like invite, or you have a Harry, so he can do the family therapist, and he can understand the history, and then LGBTQ plus, and then he also the back Asians with great plus to use our own language to explain family and then feel like when we talk about
You talk about nanny that you mentioned. What is this about?
okay, it's called National Alliance on Mental Illness. Actually, they also have the LG, LGBTQ plus group. So they also talk about the trauma and the shame, and also provide the peer support group. Like you can have come with the same age or some issue. So they is a private Zoom or in person. So you can talk about what is your issue, what is your experience about, and talk about coming out or the family issue. They can provide us support too. And it's free. You can be volunteer on that too. Or if you join the group after 8 weeks, you can also, if you're confident, you can be the instructor. If your contribute to hold the group and share your experience. I think it's helpful too. I was doing the family to family in the group 8 weeks, and then because I'm speak different language, and they also want to promote Chinese language is important because a lot of people have stigma or discriminations in Asian, in mental health in Asian culture. So I would become a doctor. So we have a group of people come in and then talk about how the family how they feel stressful as a caregiver with the for the mental patient at home. So we can share all the information, feelings is all private, and then we invite them to the instructor. So that is the family group how we grow with the army. So that's what I'm talking about. Like explore more information online and then on the person group understand what
I want to stick to the so-called cultural values a little bit. In my personal experiences also with my friends, even after you come out, even if your family accepts you being queer, you still have this pressure, internalized pressure that you must be a good kid. Meaning you must make certain amount of money, you must live a good living, they must live up to a highest standard possible. And I believe that it's also very universal. But to deal with that day to day, to always remind yourself to be a good kid can be extremely exhausting. I wonder if you have any advice for people who are actually struggling with this.
Can take on this and it's happy to join. But I guess like message to the queer community was, truly like that, and also the other message to the family members and friends around them, especially have maybe negative views around these topics. So for the queer individuals themselves, I would say, unless you haven't done it already, just communicate directly to your family that that type of being a good queer kid, whatever that means, that you guys are saying is very distressing to me. Just like saying that, that you are very stressed about. Because again, going back to maybe the cultural communication styles that we grew up in, like we don't really communicate that. And so the family member actually doesn't may not even know that you are very stressed. And if they really love their children who are struggling, they might feel differently, or at least have an opportunity to reflect like that. So just definitely, yes, it's so understandable to be defensive, but also give an opportunity to the other person that you want to get that recognition for, a chance to reflect. And one of the ways you can do that is direct communication of your feelings. So I hope that it can be a starter. Now, as for family members, I would say, I think at the end of the day, because I have treated people from also like the LGBT community, but their family members as well, like they have their own struggles, like accepting that, and also like at least young generation, right? Like that's another variable we haven't looked at. Like younger people tend to be a little bit more open about it. Okay, we're doing things like this, right? Like maybe the generation didn't even know there was a thing like that, right? So there is an extra barrier that we don't even know sometimes that they have, and therefore showing it forms of anxiety, depression, like guilt, what this means to my legacy, all that, right? I would say those are valid feelings, but definitely separate that out from validating your own children or your own people you love, because this is a time for them as well. It's very scary for queer individuals to come out and be accepted. So even though you may disagree right now and this topic makes you super anxious, try to process it separately. Maybe find your own therapist, go to family support. You don't have to show that directly to your child because that can really complicate already very vulnerable space, and it can be counterproductive to both parties. And our goal is for people to feel like they're at balance and heard. So those are some of my thoughts. Yeah.
Yeah, I think maybe just taking on, just focusing on the person, the queer individual, right? Something I like to think a lot about is, there's this pressure of being a good child, or being a poster child, or having it all together. My question is, whose voice is that? Who's saying that you have to be a good child? Is it your voice? Where does the voice come from? How did the voice come to be? Who are the people who said these things, right? Because this is the narrative that over the years, right, got created, that like I have to be a good person, to have to have it all, do it all, right? And so I'd really sort of ask folks to kind of reflect on that, right? Like where did this voice come from? And I think a lot of it is cultural, right? There's part of that is cultural, where there's sort of like parental pressure to succeed academically is one. But also I think having sort of having a bit of compassion for yourself, that you can sort of have all these feelings, right? There can be all these different parts of you that sort of are coexisting, right? Parts of you that want to do well, right? Parts of you that feel like you also want to be authentic, do like other things, right? And just sort of recognizing and like kind of holding all of that is important. Yeah.
Yeah, we actually talk about communication. We talk about communication in the family, and also mention of the parents' role in this. You know, recently, not quite recently, in Florida, you don't say gay, or it be challenging that like too early to share the idea or like to talk about sex and gender with your kids. So, what exactly is the right time to open up that conversation? peers? That's a tough question.
Yeah, maybe I'll try. So I think if we think about like a child's development, right, through childhood and adolescence, there are various developmental stages that they go through, right? Like from being baby to a toddler, then as they sort of grow into teenage, then eventually they, you know, maybe leave the home, go to college, whatever. Each of those different stages, children are sort of like biologically, and you can speak more to this on the medical side, they have different developmental abilities to process and learn information, right? And so I think when it comes to talking about sexuality and explorations of gender identity, it's important to approach it from a not gender, age appropriate way, right? Because a lot of things are happening for kids as they grow up, right? They're let's say they go to school, they go to kindergarten, right? Like someone who is sort of in the toddler age, it might be as simple as saying something like, like some boys like to wear pants and some boys like to wear dresses, right? Like trying to like start to initiate the conversation and understanding that gender presentation expression can look like a lot of different things, right? So like for a toddler, you're not talking about all the different things we talk about here, but finding ways to make it make sense for them. And I think another important milestone is puberty, right? Like as we know, as puberty hits, our body changes significantly, and with that, not only comes sort of biological changes, but our interests in like attraction, sex, all these things start to like come about. And so kind of preempting that, right? And having sort of phrasing it in a way that is appropriate for them. But yeah.
Yeah, I mean, people generally know who they are, like what they how do they identify with in terms of gender, like around age 2 to 3, and puberty hits usually earlier these days, but like 11 and 10. So those are the time frame that pediatricians might look for, but really it's about like where the children are at, what questions they're asking, and then the role of family, to the point of your question, is to be very open-minded and just validate wherever they are. Because especially if that kid is queer, they're going to be very confused, right? Like, and thinking that term, like from their perspective, it's already confusing for them. So for them, they have children, they have family. That's who they rely on primarily emotionally. So the last thing they want to hear when they are confused is for their caregiver to say like, that's not right, or like, that's valid, right? So I think it's even more important when you're young for family members to just, you don't have to again agree or anything. You just say like, it can be confusing, that can happen. Just simple things like that can like create a future space for communications when the child more questions, right? Like you have to build that relationship over your puberty years. Yeah.
Agreed. So we talk a lot about self-validation, finding out who you are, in different stages of that process. One we probably actually have touched a little bit upon is the community. So how does one find their own community, and most importantly, is it necessary to find a LGBTQ oriented community?
It's very actually comfortable about that. Like what we say, like LGBTQ plus and also the mental illness is very sensitive topic to everyone. You can go to some normal community group, but when you bring up some topic, do you feel nervous about like get the bias or criticism from others? But we also New York City is an amazing city. We have a diverse, but they also have so many LGBTQ group, LGBT group online or in person that you look for. I would suggest if you're afraid of people judging you and you don't get the support from the normal community group, you can look for specific group and then talk to them, share the experience you have, and then listen or get the similar resource from them as well. So that's because sometimes the patient will tell us like they go to the group but doesn't feel well and they get worse because people some judging them and look at them feel comfortable. They feel like, oh, it's not well, it's making cause more anxious anxiety. So they back to the book they're looking for, they found the validation. And they good. They come back with us like, hey, I joined this group, it's really good because I feel the support from the people, and then they're not judging me, they validate my feeling, and they not agree, but they open minded to our talk. Yes, it's really actually for choice.
Maybe we'll continue this conversation. There is a lot of judgment, and we know there is a predominant queer culture. We call it mainstream or whatnot. Especially in the mainstream queer culture, we certainly prioritize certain body types, views, and behaviors. So how does one navigate around that?
I mean, I want to start by saying it's very pressuring, especially when you finally, let's say, found your community that you identify as LGBTQ, and then within it, you feel like you don't belong. I can't imagine, like, right, the stress, and it certainly can be part of that experience could be AAPI specific, right? Like race related, it could be class related, it could be all kinds. So I don't want to I do want to validate first that that's really stressful. And I guess when they're trying to answer that question of like, how do you navigate that? I think first you need to love yourself. Like, if you can, then find people who can help you love you. That could be a therapist, that can be a friend, that can be queer or not. Start within yourself and like really know like strongly that your self-worth really does not depend on other people's validations, including your family. Because I think that's a true like start of the healing. And once you're sort of more comfortable with that idea, right, like find your own community within it and be proud of it, and try to cultivate more community, because you also have the power to continue to generate new ground for next generation or other to feel more marginalized. So I think those are the ways that you can continue to like navigate. Like it's hard, but like continue to find ways to validate yourself and like give others some opportunities for growth, so that for now comes to mind.
Yeah, there's so much to talk about for this topic. I think where I'll start is I think it's important to not lose sight of how, for the queer Asians or queer API, queer people of color, the context in which we live, right? Kind of to what Dennis said in the question, like there are spaces, a lot of queer spaces, it can feel like we don't belong, right? And sort of naming that sort of these spaces can be very white. They can be very sort of like, it can be a class thing, right? Like people can be very wealthy and there can be a sense of not belonging. And that can, being sort of on the outside, we can easily internalize that and think that that's some kind of deficit. We're somehow not enough, we're somehow broken, or there's not, we're not good enough, right? And I think it's important to name it as what it is that it's not that we're not enough as queer people of color or somehow deficient in a way, but that we are living within these systems of oppression that are like feeding these messages to us every day, right? You look at mainstream media, you look at sort of representation of like, gays or like even like beauty standards in general, right? It's very white, very specific kind of white person, right? And so this message is reinforced in us every day for basically our entire lives, right? And it's hard to get a break from it. And so, yeah, no wonder some of us really struggle with decoupling that from our own self-esteem, right? Not thinking that we're broken. But I think it's really important to give ourselves a bit of compassion and to really like reflect on like how we're actually kind of products of how we grew up and not so much that there's something wrong with us. I think that's really important to remember. The other thing I'll say actually on this, I think touching on Actually, we might come on to later. So much to say.
So you mentioned race, and unfortunately, we don't have downtown today, who's activist since the 70s. In history, we know that the Asian folks, particularly Asian queer folks, have been marginalized by a broader LGBT community. Just recently, I actually went to a museum educators seminar talking about inclusivity. And the majority of the educators were Caucasian and other BIPOC folks. And based on your experiences, do you think it's necessary to initiate conversations around race? Now that society might be a little bit more acceptable, and if you think it's necessary, how does one really open up and say, wait a second, race is also a very important issue within our community? Or maybe let's put it in that way. In our personal relationship, romance relationships, oftentimes, or more often than not, we engage in an interracial relationship. Hence, race becomes something that's more important, right? And a lot of folks, especially Asian folks, have experienced people claiming, especially within our community, saying that, well, race is just a sexual preference. And that becomes a hang-up. Like even early on, we have like kimchi, the drag queen saying I'm that, then an Asian. Because really early on, before 2015, I would say, people would say I'm not interested in Asian and generalize it. So it's to a certain degree, some Asian folks start internalize that and say like, well, I'm also not dating Asians. And then with a lot of studies showing that Asian men or Asian folks tend to be the least favorable partners in dating life. So how do we start this communication or conversation, whether it's inside a relationship or in broader term when it comes to a community? I know it's a loaded
I
question.
sort of like it's like somebody's PhD thesis. I would say so if the goal is to to create inclusive visible community that should be seen, I think a lot of effort should be on education and sharing the positive values that this community has to bring, the uniqueness it has to bring. And for AAPI community, let's say in position of speaking against some of the mainstream norms, you can say exactly what we're learning from the symposium, like the mental health impacts of being a double minority. That this lack of representation growing up in a society that doesn't necessarily value or portray you, obviously gonna have harder or more burden on themselves, whether it be isolation, drug use, suicide, all that, right? So these are serious issues, and they may not know that because they don't have to look with it, say, right? So just even like educating, these are the facts, and these are like how that's why portrayal and yeah are super important. And which is to say another way to say that is just be authentic and live your truth and then speak your truth, and then hopefully that resonates with some members of the other sides of the community. And I really do hope, and I do think that LGBT community, and just looking at its really brilliant history in the past 50 years of activism, like, we really wanted to show our uniqueness, against heteronormative society, and that some of the victories were achieved so far, right? So if anybody, like LGBTQ community should understand it's important to be unique and it should be valued. So yeah, I hope that, and I do think that they get it, the message. Maybe that messaging needs to come from within too, and not just from outside. So double minorities have like, I know it's like a burden, and you don't have to explain your situation all the time to your oppressors. I know, but like at the end of the day, you just speak your truth and then genuine and say that this impacts us, all of us, not just our community. It really can be a damage to the whole LGBTQ community, especially these days. Yeah.
Yeah, Harry, you mentioned, when we first started the conversation about this mental health symposium, you mentioned one of your specialties is you are working with clients dealing with interracial relationships. how do you help them navigate that?
Yeah. So again, just like Jihan said, like many PhDs are here to just in this topic. I think before I touch on the interracial piece, I think it's important to really name some of the burdens that are here in this room, right? And this is not because, I'm a queer, BIPOC, queer Asian person, like I encounter these struggles. I see a lot of queer BIPOC people in this room, and I want to sort of name it and bring it into the space, right? And to reiterate that sometimes it is really hard, right? I see a lot of sort of in my client, just in my own general experience, feeling really invisible in these spaces, not feeling seen, right? Like you might walk into a gay bar and like no one looks at you. Feeling expendable is another experience I hear a lot about. Feeling like you're just another Asian and there's so many of you and not enough, people looking or interested in you. And all these are really, really difficult and challenging experiences. And I think in the world of like Asian American psychology research, there's actually been more in the past 10 years to that have been documenting some of these experiences for queer Asian folks, which is great. I mean, overall representation in literature right now is very low, but there's more literature to say that in the world of like these kinds of like microaggressions, sorry, we call them microaggressions, where you have this, you're confronting someone might say like, oh, your English is so good, right? That's like maybe a typical thing. I don't know if anyone's like, is that a relatable experience for people? Yeah. Yeah. So like for like sort of if we put aside the queer label for just a sec, right? When you hear like, oh, your English is so good, it's like, huh? Like, what do you mean? It's like there's clearly some kind of like racial insinuation that is like a little racist, but like not enough to quite target and like pull that thing out as what it is, right? Similar such microaggressions happen in the queer Asian space, right? Oh, you're so like you have such a smooth body, right? I don't know if that resonates with people. Like like there are these sort of like really microaggressive things that are said, and the research says, I know people are familiar with like PTSD, right? But a lot of times in therapy, think of PTSD and trauma as like having these symptoms of like anxiety, irritability, like various sort of flashbacks, right? Insomnia. There's a lot of research now that shows that actually racial-based trauma can create symptoms of like PTSD without there being a PTSD-like event. So a lot of times we talk about PTSD in the context of war, like the Vietnam War is kind of how like the diagnosis of PTSD like started to come about. So a lot of like race researchers have found that actually like there's no one single like flood or war, and yet so many people of color, especially queer people of color, exhibit these signs very similar to PTSD. And I want to sort of name that because I think it's really important to normalize that like this kind of racial trauma and this profile on people is like something that I think folks need to start to notice as like connected, right? That it's not just, it doesn't have to be one big cataclysmic event for you to feel anxious. In fact, the way in which racism works in our society is all these little cuts, call it like the step by thousand cuts, right? Every little microaggression, right, is cumulative, right? Like you're out and about, like someone, I don't know, like at Starbucks will say, oh, your English is so good, right? And then you go to a gay bar, no one's seeing you. You feel really invisible and you feel really happy about it, right? All these little things, like cumulative, and there's no reprieve, right? There's like the way you present to the world is how you present. Like it's not exactly an identity that you can hide. And so I think so I just want to like name all that to start sort of encourage us to build for those queer folks, BIPOC folks out there, right? To start building some kind of consciousness around this, that like maybe there's some connectedness in all of this. And then obviously, find a therapist to work with. find me, you can find someone else. But to take that a step further, right, about this like interracial relationships. I have a lot of clients in interracial relationships, specifically AAPI and white. And so, you know, a lot I also work with couples too. So a lot of them, they'll be like, oh, our communication is not so great. I'm sure you probably like heard this. Like, we want to work on our communication issues. And it's kind of yes and no. Like, yes, of course, like communication is great. But I think a lot of times it's not so much about communication, but about empathy and openness to different cultural values, right? Because of how a queer Asian person and a queer white person grow up, their cultural values can be very different, right? And it's not so much like, oh, like this is my culture, and then the other one's like, this is my culture too. It's about sort of working together as a unit and having shared goals. I think we were talking about this earlier. A lot of couples work, you know, yes, talking about differences is important, but in my experience, it's actually about building connection and building like commonalities, identifying shared values, shared goals, right? And I think part of that is having an openness to the other person's perspective, right? And it's not about agreeing to everything. It's about empathizing, it's about acknowledging, it's about validating, right? So like, let's say, you know, that with a couple, like they're not really like seeing each other's perspectives, I think it's important to take a step back and kind of like acknowledge where they are and try to and have each person just kind of validate each other's perspectives and then sort of take the conversation there.
Thank you. I want to leave that racial part for our audience to ask later. I have two more questions before we open the floor. Sort of like continuing the conversation on the relationship. More recently, we started seeing a lot of different ways of being in a relationship. Monogamy, non-monogamy, polyamorous, and all that. When it comes to a couple, sometimes people want to explore something that's a little bit more non-monogamous. How should one navigate that very idea when the opportunity arises or the partner sense that very need?
Is there no non-monogamous relationship in hospitals? I see all kinds of things in inpatient psych actually. Okay. No, I think look the general stance today for me and for this topic is again to be very open-minded and not rush, right? Just validate where you are now. I think that can go a long way versus teaching topics like non-monogamy or different types of relationships because it can be really emotionally nerve-wracking to have this conversation and you might not feel like not seen in approaching this topic part of the unit, the couple. I would say be specifically also try to ask questions if you can, like what do you mean by this type of setup? Like what is non-monogamy to you and what is polyamory to you? Because again, like these language things, like we can't ever assume what the other people mean. You need to sometimes directly ask them, even though it's a hard question, especially for Asian folks, but like you need to like kind of, if you have to script it, just, you know, prepare for it and then ask what do you mean? And also, what do you think this would bring to our relationship? Do you have any concerns? What can this add to us? Like we as a couple. I think those type of conversations or questions rather can be really initial starting point. And also the point I made about don't press yourself. Like you don't have to answer anything. You just say, I heard this, but also this and be able to clarify your feelings too, right? Like this makes me feel ABC, it makes me anxious that I'm gonna lose you, it makes me, I don't know, whatever ABC, jealous and all types, like set boundaries that this is also who you are, how you feel, and then what you contribute to as a couple or in the couple within the couple and just be genuine. So again, stand up for yourself, ask hard questions and set boundaries or like say where you are and don't rush yourself. I think it's a general approach.
Thank you.
Let's say when we're in the hospital, it's always end up with a crisis situation. Because when you go to call hospital, it's like they're fighting, they're hurting each other, anything happens, that's why they call or go to the emergency room. But after they got the treatment from the hospital, then they can realize something going on. And then when we work in the unit, so I see some people doing like, hey, can I talk to you? I'm like, sure, let's talk. And then I'll ask them why you want that. They say, oh, I'm fighting with the boyfriend. And I said, what happened? So they would talk their perspective, saying like, I don't feel love, I have argument. They never understand me, something where they in a very not good, like not more stabilized. But after they got treatment, they're able to like realize, oh, I think I do something over there. I'm too not gentle when I ask a question. So then they starting asking our social worker to look for a couple therapists or psychiatrists to let them calm down before they can handle the situation. And it's different. Before they came in, they were so angry. They restrict the boyfriend to visit, the family member to visit. But after they got treatment, they said, you know what? I think I need to talk about it in a different way, not too aggressive. That's why, yeah, the hospital is really different. When they come in really, really not good condition. So, but after that change, so they can able to get back to the relationship and work with that too. And then one thing to say, I'm working in the judge hospital, but the unit too, I can see always the couple, 70, 90 couple, they help each other to working in the unit. And so that's something they can work on after they get the treatment.
Wow, I think we're connected because my last question is actually about queer senior members. A lot of queer senior members actually experience a loss of their beloved ones. They oftentimes go through different phases of grieving, and more often than not, they also experience loneliness. So, as our generation or as family members, how do we identify when to provide support, and how do experts in mental health provide supports to queer senior members, and most importantly, when does a queer senior member realize that they don't know help?
So in the hospital, inpatient. So when the people coming to the hospital, most often they personally they didn't realize they didn't always call help because they feel like I'm okay, I'm fine. I don't need to go to the hospital. I don't want to go that. So I think the family member and the loved one always the one that realize why you low in energy today, why you're not engaged with me, why you so aggressive, why you crying. So always the family member can I mean, not just send from the hospital right away, just ask them to start like, hey, how are you doing today? If anything happened? If you think the situation can handle the symptom or something, you can get to the professional help. So sometimes the professional tell you, hey, you have to go to get more serious treatment. So I think the family member a lot I think personally to find out.
I don't have too many experiences of where senior members specifically, but I would imagine it's like even more intense sometimes to have lost somebody that long term, especially if you were from a different generation where there was even less visibility. Like if you did find somebody and then build memories of the loss of that can be so like such an insult to your identity. So I think it's really important to validate the sadness of that person, and then like like enjoying all kinds of symptoms and things that you guys can read about. But really, at the end of the day, sometimes reaching out for help, or it can be from within you. But like if you're part of a community that has queer senior members, you can just ask how you're doing, obviously, right? or just have an event around it. Like there's an opportunity for community events around, these seniors really paved the way for us to speak like this here today, right? Like I really think about like always when I think about queer seniors, like history of AIDS activism in the 70s, 80s here. And like they literally sacrificed like their body and mind for the next generation. I think there's such a, not to be Asian about it, but like duty to feedback, or at least like just show some deep appreciation for, kind of like your cultural parents. Like for you to be gay, that's free sometimes. It required a lot of people's work, and validating that, and then like celebrating people's lives and their loved ones or loss of loved ones um, within the community can be really therapeutic.
And I'll just add, plus up to everything that's been said, I think it can also be challenging because I feel like there's such low representation in like queer seniors, especially in the API community. And so like events like this, right? Like we had Dom Cow and like the storytelling events are like exactly the kinds of community events that we need, right? To bring people together, to pass down stories, to lean on each other's cultural strengths. And so, yeah, having sort of, you guys are doing great. Love this work, right? It's really important work, right? To bring people into the door and to sort of help people feel just a little less lonely. Yeah, because I think already, like even if you're not queer or even if you're not senior, right? Like it can be already a very lonely world. And yeah, imagine it's very nice.
Thank you so much. I think it's time for us to have some questions from our audience. If you have any questions, please feel free to raise your hand. Yes.
Thanks everyone for being here and for sharing your experiences. My question is about kind of like your schooling, and I imagine a lot of frameworks that you learn about in the field of psychology is based on maybe some outdated or like systemic kind of like things that were built around like white men from like the 50s, let's say, who did a lot of like the early research. So how do you fit your like modern narratives or your understanding from like a cultural perspective into things that you might learn in school that you think are not correct?
Thanks. Thank you for the question. I think the field of medicine, not even just AAPI, but people who are just different, like has done such disservice to their livelihoods and their mental health by like things like diagnoses on Diagnostic Statistical Manual, DSM-5. For those who don't know, that's like a sort of a quasi manual that mental health professionals use to diagnose. Because you're right, like going back to 50s, like your identity itself was pathologized. It's nothing, just by being existing, you are mentally ill based on DSM. And the earlier version, I believe, was calling it sociopathic personality disturbance initially. And then they kind of changed it to sort of homosexuality as mental illness. And so there's a lot that has to be sort of uncovered, like we definitely earn medical distress from those people, continue to be. I also want to think that like the history of medicine, and this is my personal hope, but it has been also the narrative of change. So they depathologized since the 80s. They kind of changed the diagnosis into gender identity disorder, and now gender dysphoria is still not okay. But like, right, like I think to your point, like how do we move from here? Like we need to actively validate that like existing is not mentally ill, but being stigmatized can make you mentally ill in the form of anxiety, depression, suicidal thoughts. Like we need to understand, right? This is what hopefully medicine is trying to do, is not to just look at a person to be fixed, but like a person in the context of society that can make people ill. And that's not just mental health, physical health too. What you put in body can make you diabetic, right? Like it's not just your genes. It's the same approach. I think you just need to be humble as a medical community and just see where you can correct. I know a lot of like treating folks are not even requiring DSM-5 billing codes to like do surgery and things like that. They are using different codes like ICD-11, which says gender incongruent for trans folks. But like they had to mention something, right? But like just words matter, I agree. That's the messaging. So I think people within and outside of the community need to advocate for the correct way to go forward.
Maybe I'll add just a quick tidbit on from the therapeutic modality perspective. I think also sort of, as you mentioned, like a lot of the therapeutic modalities. So water psychotherapy is really young. It's a like 19th, 20th century movement or field. And so a lot of them were invented by like middle-aged white men in Europe, right? And even like what we consider gold standard treatments today, like cognitive behavioral therapy, if you go to CBT, right? Like don't quite capture the kind of world in which we live in, right? Like CBT is all about changing your thoughts and behaviors and feelings. They're all related, right? So you change one, you can change some of the other things, right? But what that kind of Western like Eurocentric model fails to capture is that, you know, it's sort of like inequality in class and socioeconomic status, right? If someone's living in like poverty, right, and they're having like all this minority stress because they have all these minority identities, and you're telling them, oh, well, just like you need to just change the way you're thinking, it's gonna fix things, right? It can feel very invalidating. And I'm not saying that CBT doesn't work. Obviously, there are gold standard RCTs that prove that it does work, but if we're thinking it from more of a kind of like a systemic and cultural lens, a lot of that research is normed on white populations and less so people of color. And so it's important to really start to acknowledge that. Put into perspective, right? We have the feminist movement in like the 70s. And that was around the same time that psychotherapy started to have its own feminist movement, ways of thinking around, you know, rights to education, rights to sort of, you know, self-authorship, all these principles. The movement of being multicultural, sort of acknowledging and centering different cultures, was in the 90s. Like I was born in the 90s. So along lines of what Jihan said, this is an industry ripe for change. We're kind of like at the forefronts of it right now. It's both exciting, but there's so much to say about it. Yeah.
Thank you so much for your time, everyone. And I'm actually glad that you took it that direction here because my question was about just listening to you guys talk. I feel like Jihan, you have like it sounds like you have a reverence for the like proud tradition of activism and your community and where you talk about inequality and inequity and things that actually like hinder positive outcomes and someone's life. So let me get to the question. So my question would be, what role do you think that activism plays in the mental health care world and activism, which is like aimed at changing the world for the better? And how do you sort of combine the two, or if at all? So a lot of people would say, separate, but it sounds like you guys are like big on focused on that aspect.
I would say, like, people love to be like, oh, well, like, politics don't belong there, therapists can't be political. Right? And I think that's just a whole lot of nonsense. Especially for people who work with queer people of color. Like, our lives are inherently, like, we don't, like, get a choice, right? But to be political, to be in a system that affects us. And by being in a system that affects us, we are political, right? We're at the mercy we're being influenced by all these policies, right, that are being enacted upon us. And so for me as a provider, to sit there and like validate my client's feeling, like, oh yeah, it is really difficult. I can do that. I can do all of that. But time and time again, they keep coming back because of the society that we live in. Right? Until we are working to dismantle some of these systems of oppression, we're going to continue seeing the results of it. And I think it's activism needs to go hand in hand with therapy, right? And a lot of therapists out there will maybe disagree, and maybe I'm a little extreme, but I definitely do think it's inherently like they go hand in hand.
Yeah, thank you for the question. I think for me, the function of activism is to change the portrayal of people in society, because a lot of times the narratives are around hatred and like different exotic, whatever, right? So activism, if it geared towards portraying authenticity of an individual as who he is or she is, they are like in their own cultural environment, in and of itself can be so again validating for the people who belong in that, just showing that. And that alone can really, speaking of the minority stress framework, like it can really it can be like a therapy. Like it's not you're talking to somebody, but just seeing yourself, for example, the TV saying, "Oh, is there somebody who root for me?" And in a city that maybe you feel like you don't have anybody, that can be healing within yourself. So I really strongly believe in the power of media and just any societal, primarily like these things that we grew up watching and reading. Those things I think those are serious stuff when it comes to mental health outcomes. So I think those are the angles that I always think about when I'm whether the patient you're doing more community outreach work, like is this going to help the patient? Um, and if the answer is yes, like why not do it?
Actually, my question is sort of a follow-up question to this. So I'm wondering, like, incorporate activism into your clinical work, or so it's like doing social justice work in your practice. What does it looks like in practice? Is there any like examples or experience to share?
Yeah, I mean, that's interesting. Thank you for the question. I think activism can look like a lot of different things, and it needs to look like a lot of different things, right? I think maybe sometimes you think about it like being in a protest and like showing up, and I think there's definitely a need for that, right? But it can also, I think, especially being in the therapy space, it can show up in a lot of other ways because we're naturally maybe not like the most visible and like frontline, right? So like our like my work, my colleagues work at the collective, we work a lot with providing therapy at a very low cost for like activists, for organizers, for folks who can't afford it, right? Which is our way of like providing equity back into society. We're involved in like various like mutual aid efforts, nonprofits, and then we're involved in a lot of just like writing and producing content for the community, and just bringing community together. The other thing I want to say is just like we are also activism. Our representation here is activism for someone else, right? Someone seeing us being authentic, right? Showing up to spaces is inspiring others. And so I think that's important to remember too, is that you're also a force of change, right? Just by being who you are. So.
Actually happy to hear what Grace Square's been bringing up, but like just to speak about the work that we do as Hamilton Madison House, that's the organization I work in. So activism, you're right, like it can look so many different ways. So our way of showing that is to really pay attention to like the social factors that impact one's health and then actually take a serious step at changing it as a team. So like for example, in the emergency room in a traditional medical setting, you're quote unquote like patient, but they're not acutely like sick. And this person, let's say, had like discrimination, HIV, like housing is not there. Like sometimes we don't have time or faculty or like people staff to do this work, to like follow up. So like our program really makes a point to identify that as treatment problem that clearly this does affect somebody's loneliness, depression, or whatever, and at least try to enlist some community service organizations to like reach out to them and then ask them like, do you need this or do you think you need help? And if they do, we have like in-house housing applications with an organization, so we help them out. So it doesn't look again like a mainstream portrayal of activism that you see with like a blood in your face, but that also is necessary. I think there should be all forms of activism, but just showing up, paying attention to things that matter to a human life, and then caring about it as a form of activism in the organization.
So us will be like, so about like 2 years ago when I was working in a school for my degree and also working for the community outreach coordinator. So we working with different outpatient organizations. We provide free mental health workshop and a seminar to different people in different language. And also we have specific program in the hospital, like all this college check and Asian and geriatric unit to try to target different mental illness on different population. So yeah, so that's what we do right now. And also we open to all the population. Recently we have homeless people or from the background from different Asian different things. We are very freestanding, so see who needs help. And then why now? Because we have the Asian unit, I think also benefit to Asian folks who doesn't speak English, the family member. They don't have help. When we're in the unit, we talk to the family member, probably they have a different issue. And then I talk to them in Mandarin Cantonese. They'll be like, you speak that language? Yes, I am. So they can able to tell me what's going on. And then I will share my information when we get from the outpatient, like come to medicine house, tell them they can look for people for there's for supporting. That's what we're doing now. And we try to reduce the stigma and the discrimination for in this. Yeah.
Hi, thank you so much for this like really lovely panel. Actually, so I'm a researcher and a program specialist at the health department, and I'm actually working with Hamilton Medicine House right now at Columbia University to adapt what we call the family checkup. So we're doing this demonstration project, and the point of the adaptation is to make mental health services more culturally competent to serve Asian American youth and families. And a part of that, the primary intent is to look at the ways in which Asian American families talk about suicide and address suicide. And I'm wondering if, like, as a part of your work, if in terms of like the therapeutic modalities that you've used, if you have had to adapt in order to sort of like make those interventions more culturally competent, right? So yeah, but really great work, really great panel.
Yeah, thank you so much. Yeah, happy to talk more. There's a whole team out there too.
Any more questions?
Sure. Hi, I live out in Long Island, where during the 3 years I've been undergoing therapy, my therapists have changed, and none of them have actually been of age in a sense. Now, I briefly worked at a children's hospital on Long Island many years ago, in which racially congruent or ethnically congruent staff for the patients, who are all minors, did not exist. So I'm wondering, in your educational and clinical experiences, have you seen how cultural competence has moved forward? Because one of the things I'm afraid of in this particular new presidential term is that a lot of the support, a lot of the foundation for mental health specifically is going to be taken away. So I'm concerned, as a member of the AAPI community, how can people like me be supported in the future? And I don't know the answer to that question. You might not. But has cultural competence on the part of for example, non-Asian clinicians, has that gone forward so that they can treat a variety of people in places where racially congruent clinician to patient populations, ratios rather, do not exist? Thank you. Sorry.
Yeah, thank you for your question. I think the cultural competence piece is so important. Right? I think it's, yes and no, and I think that's kind of a sad answer. I think that in school, sort of in the therapy like master's curriculum, there is focus on cross-cultural competency. There are classes on cross-cultural competency. And so I think there is generally, depending on what school you go to, a pretty good focus on multicultural counseling. At the same time, I like to hear some horror stories as well. And I can't speak for different therapists, but what I can speak to though is I think there is a rise of different AAPI specific mental health resources coming out. You know, there's like Asian Mental Health Collective that has like this directory, AMHC, Asian Mental Health Collective. They have a directory of all different kinds of API clinicians. And so, you know, that can help with finding care that best suits your needs. So, yeah.
I know there's also the Yellow Share Collective, which has done some presentations under the auspices of the UNV bookstore. They did an event, I think, last month for, and there are tons of books that are coming out now that are helpful. I've been reading.
Yeah, I also don't have like good answer to the question of like have we improved or not. I mean, I hope at least in terms of visibility, but like I think visibility is not everything, obviously. Especially as you are sort of intimating the sort of backlash of DEI and all this like, oh, like another checkbox, another module to complete that your busy work covers. We don't want like our work or impact or what our messaging is down to just another checklist, right? So that means that we really need genuine invitation to learning and humility. And I don't know if that culture, which means to me like culture needs to change, but inclusive learning. I think that is very institution specific, city specific, organization. So I do think leadership really matters. Who makes these decisions? Culture, people who make culture within any organization, I think, are really important. Having even more important roles these days. Hopefully, right people also are in the positions. And as far as like your involvement goes, I guess I don't have any other thing else to add than just be truly yourself and then just see how your authenticity can be best incorporated in whatever venue that you want to work in. Because I think you need to feel like you belong to do the best academic work. And sometimes otherwise we feel like tokenized, and that's disruptive usually.
Do probably would have one or two more questions, anybody? Yes.
Sorry, I was sorry,
I'm sure.
I'm a psychologist and I also try to be more connected to my community. And I actually recommend, there's a few, there's the Asian American Psychocentric Psychoanalysis that's new, just started this past year. And then there are a few peer-based, so they're not centered around Asian communities, but Manhattan Alternative is a community for your folks and therapists, and so the directory for reviews. There are two bridges in Mount Street C Generation, essentially Korean Americans. So if you need any of these resources,
I've been working on a book on the challenges of being an adult caregiver for immigrant parents. You know, part of my research is finding out like how did that fall through the cracks the past 50 years? How did other people like fall through the cracks? And I guess, you know, I have a goddaughter presents as Asian, although she's Papa. And I'm concerned about her. She's 10 years old. I'm worried about her future. And other kids like her. Thank you.
Anyone have any questions? No? All right. Well, so in addition to our talk, we actually have some information in the back. There are several tables. We have how much members we have present there. We also have Charles P. Wong coming from the center on the corner. We also have information from Chinese American Planning Council that actually provides free hepatitis, HIV, and STD testing. It's all anonymous. So if you need those informations, you can see all those tables. And also here you have your business card laying out there. So if you need anything and if you want to have more private conversation with our experts and resources, please feel free to do that. So last but not least, thank you so much for instructing.
self-care also do that amazing. Oh my god, I made it.
Here in Museum of Chinese America, we are really committed to preserving a space for the queer folks. We have a lot more programs coming up next year, and just in 15 minutes, we actually have author Curtis Chin talking about his life journey being a queer man and living in Japan. So please keep it up and please do come and need your support. Thank you so much. Have a good afternoon.